Hello, everyone. My name is Zoe, and my core advocacy project at Nebraska Methodist College focuses on childhood poverty in Nebraska and how it impacts children's health, development, and future opportunities. When I started nursing school, I knew I wanted to help people because of my experiences as a CNA. Caring for patients taught me that compassion, dignity, and kindness can have a lasting impact. At that time, I thought nursing was mainly about providing excellent bedside care. Through this project, I realized that many of the health problems we see begin long before a patient enters the hospital or clinic. That realization shaped my perspective and inspired me to focus on childhood poverty. The first section of my exhibit highlights where my passion for nursing began. My experiences as a CNA taught me the importance of treating every patient with compassion and respect. I also included my public health and health equity assignment because it was one of my first times I connected the social determinants of health to nursing. Researching food insecurity helped me understand that factors like income, housing, education, and access to healthy food have a major impact on health. It changed the way I think about caring for patients and showed me that nurses must understand the challenges people face outside of healthcare. Every individual that comes into the hospital must be treated as a whole person and not just focusing on the individual issue at hand to help treat them the best and give them the best outcomes. I chose childhood poverty because I learned it is much more than a financial issue. Poverty affects children's physical and mental health, their nutrition, their education, and their future opportunities. As I expanded my research, I focused on childhood poverty in Nebraska. Even though Nebraska ranks well overall, thousands of children still experience poverty, and those challenges disproportionately affect certain communities. And this research helped me realize that improving health outcomes also means addressing the conditions in which children grow up. After completing my brief, I expanded my knowledge further and researched with Nebraska and wrote a paper, which is included, that includes all of the research that I found with childhood poverty in Nebraska. As I continued learning, I realized that improving children's health requires more than treating illness. Healthcare systems, community organizations, and public policy all work together to address childhood poverty. Before this project, I had not thought much about policy, but now I understand that decisions made outside of hospitals directly affect patients and patient care. The access to care is also affected by policies, which is very important to advocate for. This changed the way I view nursing because advocacy includes supporting the systems and policies that improve health equity overall. The advocacy portion of this project challenged me to move beyond learning about a problem and actually take action. I created an educational infographic to raise awareness about childhood poverty and wrote a formal letter to Nebraska State Senator encouraging continued support for programs like SNAP, Medicaid, CHIP, and school meal programs. This experience helped me realize that nurses have an impact and an important voice outside of direct patient care and can advocate for changes that improve the health of the entire communities. I also created an advocacy plan, which is included in this exhibit as well, with further means of advocacy that I would like to implement to increase the awareness of childhood poverty in Nebraska and make a difference in more children's lives. Looking back, I can clearly see how much I've grown through this project. I started by thinking nursing was primarily about caring for individual patients, and now I understand that nurses also educate, advocate, and help address the social factors that influence health as a whole. As I begin my nursing career, I hope to continue advocating for children and families experiencing the health disparities and make a difference in their lives and treat them as a whole person. Whether I'm caring for patients at the bedside, connecting families with resources, or supporting policies that improve healthcare access, I want to use my voice to promote health equity. This project has helped me grow not only as a nursing student, but also as an educated citizen. It has shown me that creating meaningful change starts with understanding the problem, speaking up for others, and never losing sight of the people we serve and who we are and what we are advocating for. Thank you for taking time to view my exhibit. Overall, I have learned a lot through my nursing experience at Nebraska Methodist College.